Is God responsible for birth defects? Hi guys, it's registered nurse Ben is here, and in today's video we are going to be answering a very pressing question in the hearts of many pregnant women and mothers of special children. Is God responsible for birth defects? Now, there are certain reasons for birth defects, but I'm here as a midwife to certainly tell you that God is not responsible for birth defects. There are many reasons why birth defects happen, why children come out and they have certain conditions such as Down syndrome, they have conditions such as autism and Edward syndrome. You see children come out and they are just not normal like the other they are supposed to be. So the question that keep going on in the mind of these women is, but I was prayerful when I was pregnant to this child, but I prayed to God. So is it that God is punishing me, or is it punishment for my sin, or is it my village people? This question comes to mind. But there are certain precautions that pregnant women fail to take, which puts them at risk for having children with birth defects. Now, there are many pregnant women that maybe you are sick and then probably you had hypertension before pregnancy, or you had tuberculosis. You already have a particular condition. You already have a particular condition that is wrong with you before pregnancy, and now you are pregnant, you are still continuing that line of drugs, not wondering to ask if it is safe for my baby. Now, if you are having unprotected sex and you are expecting a child, please, before taking any drugs, ensure to test if you are pregnant. It is essential that every married couple or every couple expecting a child have a pregnancy kit in their houses, so that every moment before you take any drugs, be it malaria drugs, be it typhoid fever, be it antibiotics, whatever you are taking, as a lady, test if you are pregnant first, so you don't start a medication and then you not realize that, oh, I was 2 weeks pregnant, oh, and it's not safe for my baby. Do you understand? And then another thing, in Nigeria, a lot of women don't like registering for antenatal on time. They like coming for antenatal maybe when it's their 6 months, because they don't want to come to the hospital regularly. And during this period, they go to the pharmacy, the chemist, over the counter medication. Please give me these drugs there. Or you are coughing, you're having catarrh, you're having this, and then you quickly run to the chemist. I beg, madam, give me cough syrup. Madam, give me this one. Madam, give me that one. Administering drugs to yourself. So self-administration is number one reason. Self-administration of drugs is number one reason why many children come out with birth defects. Another reason why children come out with birth defects is genetic mutation. Many a times these things are already genetics. They are already genetics. Now, I will still want to emphasize more on this administration of drugs. There is this popular drug, flagyl. Flagyl is safe in pregnancy. Flagyl is this, flagyl is that. So certain drugs can be safe in your third trimester and may not be safe in your first trimester. That is why it is important to speak to your health professional, speak to your midwife, speak to your doctor, speak to your gynecologist first before taking any drugs. And then always adhere to instruction. The drugs given to you in the hospital, drugs such as folic acid given to you in the hospital to help prevent these birth defects, neural tube defects. Pregnant women will say, oh, the drug is smelling, oh, the drug is this, and they don't want to take their medication, thus putting themselves at risk to birth defects. So in essence, in general, in summary, before taking any medication, please and please ensure that you consult your midwife, you consult your doctor, your gynecologist, to know if this medication that you want to take is safe for you, thus preventing the risks of giving birth to a child with a genetic defect. Another reason for birth defects is ignorance. Many people are ignorant. Many people are ignorant of the things they are supposed to do and the things they are not supposed to do in pregnancy. Another reason for birth defects is due to genetic mutation. Sometimes these things are already in the gene of either of the partners, and it cannot be avoided. Sorry to say, it cannot be avoided. So when it comes out like that, the X chromosome, the 23 chromosome given by the male and the 23 given by the female, many a times maybe one of the couples is releasing 22 instead of 23, and the children with things like trisomy 21 or Edward syndrome, these are genetic conditions whereby the chromosomes are not complete. So these things are genetic conditions, and God is not literally responsible for them. We just pray not to have children like that, but genetics is one of the factors that causes birth defects. Then smoking and drinking in pregnancy. You are a pregnant woman, you are smoking, you are putting your baby at risk. The child lungs is at risk. The same way your own lungs is at risk is the same way that child lungs is also at risk. So smoking and drinking in pregnancy tend to increase birth defects. So with these few points that I have listed, I believe that you are convinced or your questions have been answered that God is not to be blamed for genetic conditions and genetic defects that occurs in pregnancy. If you have any other reasons or you think there is other reasons why genetic defects happens, please put it down in the comment section.